Hi guys, so I have a case study for you. I have a patient who was on 5 different insulin medications, or blood sugar lowering medications. So I believe 3 of them were insulin and 2 of them were like metformin based. And this person was not really being managed very well, in my opinion. They had, like I said, 5 different blood sugar and lowering medications, and they were just being told to, like, oh, we got to raise it more, we got to raise the insulin more, and this just does not, they weren't getting better. In fact, they were getting worse. So let me lay out a little bit of what this person's life looks like. So in the morning, they don't feel like eating, and that's a problem because they would immediately go take their insulin first thing in the morning so they remember to take their meds, right? And I guess that's what the paperwork said to do anyways. Well, they didn't eat. So now you are in this situation where you have been fasting all night long, right? Because you didn't eat anything and you're probably dehydrated. So your body your body will always regulate the amount of blood sugar in the bloodstream to make sure that there is enough, no matter what it has to do to make sure that, your brain will function on enough. It's never gonna, or it's very, very rarely gonna be deficient in blood sugar in the bloodstream, but excess is a problem here. So you've been fasting, and now you wake up in the morning, and the first thing you do is take a medication that is going to lower your blood sugar more. So your blood sugar is already low because you haven't eaten in like 8 hours. Now we're gonna lower it more without eating. And what do you think that's going to make you do? It's going to make you feel super sick because you're going to see all of these hypoglycemia symptoms, like symptoms of too low blood sugar, because now we're forcing it lower, especially if you're taking more than one medication to lower your blood sugar. So what is your body going to try and do? It's going to try and bring that insulin or that blood sugar back up because it needs to maintain a certain level so your brain doesn't go into a coma. So it's going to bring it back up, and your liver is going to be working really, really hard to like break down glycogen, break down fat, do what it's got to do to like raise it up. And you're going to be going like this yo-yo effect that you feel like crap. Then the next time that you eat, your body is going to be like, shit, we got to store anything extra because we just had like this crazy fasting time where we dropped super low and we had to store all of this, and it was not good. We don't know when we're going to eat. Store everything. If you either use it or store it, we gotta store like crazy. And this is why you see these patients that continually get worse because they don't understand that they have to eat. You have to eat when you take this medication. It's actually better for you not to take the medication if you don't eat. Like, you have to do this in order to manage the blood sugar. Now, I understand that overall that the blood sugar is high, but your skew changes just a little bit, and it's a very, very delicate balance once you start messing with that. So the moral of the story here is the 5 different medications, that's insane. That's insane. Even on drugsinteractions.com and stuff like that, it says you should only be taking 2, So we obviously talked to her about that. And she went and talked to her primary care. But that is insane. Like, what are we doing as clinicians if we are giving our patients 5 different blood sugar lowering medications, not monitoring what they're doing with it, not monitoring what they're eating or how they're eating or any of that, telling them lose weight, exercise more, and raising insulin all of the time, and it just keeps getting worse. Like, it is insane. So as you're looking at some of these case studies, I want you to think about it in terms of, or even if it's yourself, how is this the proper management of what we should be doing? And if I understand what is happening with blood sugar, then why is this the route that we're taking? I just thought that was a really telling situation, and obviously I got a little bit upset about it because it's just insane to me. And it's just a damn shame because all of these people stay sick because of that. So anyways, that's the story I wanted to share, and I hope that it gave you a little bit of insight into how this can be super mismanaged and why it's important that you get somebody who knows what they're talking about with this. Thanks, guys.